had a few questions lately about testing instruments, specifically scissors. So I thought I'd get a small selection here of some scissors and show you how we inspect and test them. First thing you'll notice is there's a different variety of sizes of scissors. These have a longer shank and a shorter cutting edge. These are almost even, shank and cutting edge, and these are little tiny scissors. So this is a Metzenbaum scissor. These are Mayo scissors. This is a curved and a straight. You'll notice with these here, the gold handle, that indicates a tungsten carbide cutting edge. It's a stronger cutting edge on that. The silver handle is just the standard stainless. This is a fiber wire scissor. The black handle immediately identifies it as a supercut scissor. And this little guy right here is an iris scissor. All of these scissors, with the exception of the iris, are about 7 inches in length. And the way you measure scissors is from the tip to the end of the ringed handle. Got a little scale down here, a little measuring tool. And if we go from the tip to the end of the ringed handles there, it's exactly 7 inches. These Mayo scissors, this is a 7-inch Mayo, curved, 7-inch Mayo straight, and a 7-inch curved fiber wire. This is actually 6 and a half, so it's a slight bit shorter. The iris scissor, that's going to be right around 4.5. So that's 4.5 inches. When you inspect scissors, first thing you're doing is looking for any debris, any bioburden left after the cleaning process. You want to make sure there's no pitting on the inside of the hinged area there. Make sure there's no cracking around the hinge point, that screw right there. Again, looking for bioburden in the slot of the screw. You want to make sure there's no cracking. This is the weakest point of the scissors right here. It's the least material, the least metal right there. And you want to make sure there's no cracking present. And you also want to make sure the back end has the screw is flush. It's not recessed in or sticking out at all. You also want to make sure that the rings are not cracked. That can happen. I've seen that. And just overall a good, clean-looking instrument. Another way to inspect scissors, if you don't want them to be too tight or too loose, so you can, I don't know how this will come out, but you can just kind of drop down like this, and there should be a gap. It shouldn't close all the way flush, and it shouldn't stop all the way up here. You should have a nice little stop right there to the scissors. That indicates that it's not too tight and not too loose. You also want to make sure that there's no wobble in between the hinge there. Make sure it's a nice solid attachment point. The testing material we have here, different colors. These are the non-latex versions of the red and the yellow. It's orange, and I think they call this peach. So the non-latex versions. The orange or the red is a thicker material, and it's used for scissors that are longer than 4.5 inches. So all of these scissors will be using the orange material to test. Anything 4.5 inches or smaller uses the yellow or the peach colored material. It's just a not as heavy. It's a lighter weight material. When scissors are being used, it is not the whole cutting blade that is being used in a surgery, in a procedure. It's just really about the first third of the scissors, so the tip, third to a half. And the way we test it is using that first third to half of the scissor. Just gently snip, and it should release right away. You should cut and pull, cut and pull. It shouldn't snag, it shouldn't tug at the material. Cut and pull, cut and pull. Do that about 4 or 5 times. Now that's a nice clean cut. That's a nice sharp instrument right there. Let's go with the Mayo scissor here. Do the same thing, just using the first third or so of the blade. Just snip and pull, snip and pull. It cuts clean, it releases clean. It's not snagging or tugging at all on the test material. Nice, clean, sharp cuts. The iris scissor, again, these are the same makeup, the same build as a standard scissor. It has the hinge screw there. You want to make sure that that's clean, make sure there's no pitting, make sure everything is nice and straight. Another point, you want to make sure the tips come together, they overlap properly. You want to make sure that there's no gaps. The overlap is good. Make sure the set screw is good in the back. No cracking, no pitting. And always for cleanliness, make sure there's no tape, no sticky stuff on any of these, and no blood or debris or bioburden. So these are going to be tested with the thinner material. Again, just the first third, just snip and tug, snip and tug. And those cut clean and release clean. So that's it. That is how you measure, inspect, and test scissors.